So he cited a report that was done by EPI that we actually worked on with the group. Brought a whole lot of issues of the state of workers of color in Rhode Island. We did one that was focused on the state of black families in Rhode Island. One of the things we found was that health outcomes for black folks and for people in color in general, but for black people in particular, were terrible. We have per capita one of the oldest median populations in the country for white people, but for black people, we're just not surviving past 62, less than 2%. And that's a really kind of devastating thing when you think about what that means for growing old and growing as a human being. It means that we don't get to see the golden years a lot of the times, and that means we have to fight a little bit harder for what we can get today. That, in addition to incredibly high rates of maternal and infant mortality for New England, but also nationally, Rhode Island is not doing great in those regards. So to think about equity in health, I'm very, very lucky. I'm very honored to have Mark Ryan from the Physicians for a National Health Program here to speak about what it means to make sure that we all get the equity in health that we all deserve. Thank you.
Thanks, Mike, and thanks a lot for allowing me to talk today. My name is Mark Ryan. I'm currently the chair of the Rhode Island chapter for Physicians for a National Health Program, which I had a sign which fell over, which is a group of 20,000 doctors whose purpose it is to institute a single-payer universal health insurance program that guarantees equal access to health care for every American. Today, we're commemorating the Reverend Martin Luther King, who was brutally murdered 50 years ago for having the temerity to suggest that in a nation founded on the principle that all men are created equal, all people should be treated equally. Dr. King helped lead the civil rights movement of the 1960s, which fought to bring justice to our nation. And in 1966, he said, "Of all the forms of inequality, injustice in health is the most shocking and inhuman because it often results in physical death." What could be more shocking than to bring a sick child to a doctor or hospital only to have that child not receive proper treatment?
I have to take something.
That's okay. You can leave it there.
I'm a black woman.
Mike, I think we're violating labor laws if this is one of the volunteers here. But anyway, that's okay. You're doing a great job. Anyway, the act itself is not only inhumane, it involves healthcare workers, people we rely on, to act with compassion. Instead, they're encouraged to act with the very opposite of compassion, to discriminate against a child because of her economic status or the color of her skin. To try to correct this injustice, our government enacted Medicare and Medicaid in the 1960s, government-funded health insurance programs to eliminate institutional barriers to health care. 50 years later, have they accomplished this? Apparently not. A child born to a black mother is twice as likely to have a low birth rate and to die in the first year of life than a child born to a Caucasian mother. Black mothers receive less prenatal care and their children are less likely to be vaccinated against common childhood illnesses like measles and chickenpox compared to Caucasian mothers and their children. A boy born to a black mother will live 5 years fewer than a boy born to a Caucasian mother. A child born to a poor family will live 15 years less than a child born to a wealthy family. In 1964, Dr. Quentin Young, one of the founders of Physicians for a National Health Program, who served as Dr. King's personal physician during his time in Chicago and later was physician to Barack Obama for 20 years, founded the Medical Committee for Human Rights, which set up Black Panther and Young Lords health clinics across the South for civil rights workers during Freedom Summer. Dr. Young was very active in the civil rights movement because, like Dr. King, he too recognized that without equality in healthcare, there is no equality in health. Dr. Young recognized that when you fund different sectors of healthcare for different groups of people, you get separate but equal funding, which produces separate but equal healthcare. And as history has taught us, and as everyone here knows, such systems always remain separate, but they never remain equal. And in 1964, the federal funds were doing just that, funding separate hospitals for black and white patients across the South. In Dr. King's words, "We are concerned about the constant use of federal funds to support this most notorious expression of segregation. To some degree, this discrimination still exists. Medicaid payments to doctors and hospitals are lower than other forms of insurance, and hospitals that serve the poor, so-called safety net hospitals, rely on Medicaid and Medicare funding. Yet even the Affordable Care Act, that did so much to expand healthcare access to more Americans, had a cost savings provision in it that reduced Medicare funding to these hospitals by $60 billion over 10 years. Dr. Young realized that the only way to guarantee that all Americans get equal access to health care is when you remove the institutional barriers, the financial barriers, that not only make discrimination possible, they encourage it. When all Americans have the same insurance, the same access to health care, it will become possible to direct funds to provide care where it is needed, not just where it is most profitable. During the last presidential primary, Rhode Islanders voted for a candidate whose central policy was the single-payer Medicare for All program that Dr. Young had worked on for most of his life. We have another chance this year. When you go to the polls this November, find out where candidates stand on universal health insurance, on Medicare for All. The arc of the moral universe is long, but it bends towards justice, said Dr. King. But it will only bend toward justice if all of us work together to do the bending. In his words, so let us march on ballot boxes until we send to our city councils, state legislatures, and the United States Congress people who will not fear to do justly, love mercy, and walk humbly with God. Thank you.
So health equity is like if we're not living healthy lives, then we can't live towards equity at all, right? So having Dr. Mark kind of lay out the case is so important. So we have to be working to make sure that we're including the whole human being when we talk about civil rights, when we talk about equity.